Welcome to Section 8 of Neurology. In this section, we'll be discussing seizures. Let's get started. Here's our overview slide. Let's begin by discussing some basic principles. Seizure is defined as abnormal electrical activity of the brain that results from hyperexcitability of neurons. This can be partial, which refers to the fact that only one part of the brain is affected, or generalized, which refers to the fact that the entire brain is affected. Seizures can be caused by genetic and structural brain abnormalities. Metabolic abnormalities, such as severe hypoglycemia, can also cause seizures. Other causes include tumors, infection, trauma, and stroke. Manifestations depend on the location of the abnormal activity and whether it affects one side or both sides of the brain. Seizures can be provoked by a lack of sleep, stress, and excessive alcohol consumption. All right, now let's dive into the specific types of seizures, beginning with partial seizures. Before we jump in, let's take a look at this overview diagram. Notice that seizures are broken up into several categories. First, those that involve one hemisphere, and those that involve both. If only one hemisphere is involved, it's called a partial or focal seizure. So, partial seizures are those that affect a single area of the brain or are confined to only one side of the brain. They're also called focal seizures. Partial seizures are most commonly caused by a structural brain abnormality that likely leads to the electrical imbalances in the brain. The temporal lobe is the most common lobe involved in partial seizures, though all lobes can be affected. Patients may experience an aura prior to the seizure onset. An aura is characterized by sensory or psychiatric symptoms that can occur before the onset of the seizure. Examples of auras include experiencing fear, déjà vu, or seeing bright lights. Because the seizure is focal or affects only one side of the brain, symptoms therefore usually only occur on one side of the body, usually contralateral to the affected side of the brain. So for example, if the left brain is affected, the right arm or right leg may be involved in the seizure. Partial seizures are described according to whether there is an impairment of consciousness, and there are two types of partial seizures, simple or complex. So if we return to this diagram, we can see simple and complex. With simple partial seizures, consciousness is not impaired, so no impaired consciousness. With complex partial seizures, the consciousness is impaired, so yes. It's difficult to assess impairment of consciousness during the seizure episode. The easiest way is to ask the patient afterwards whether they remember what had happened. If patients can recall the episode, then their consciousness was likely intact and they had a simple partial seizure. Another point to consider is the presence of a fever. If the focal seizure is thought to have been caused by a fever, then the diagnosis is a complex febrile seizure. It's important to note that seizures can start out as partial or focal in one side of the brain and spread to the other side of the brain, resulting in a generalized seizure. This progression is called a secondary generalized seizure. So to review, a simple partial seizure is a focal seizure where consciousness remains intact. Symptoms vary depending on the affected region. This includes motor, sensory, autonomic, and psychic symptoms. Motor symptoms include repetitive muscle movements or jerks. An interesting series of motor symptoms can occur when the abnormal electrical activity spreads to adjacent areas of the brain. This is called Jacksonian march, as the symptoms march and progressively involve other muscle groups. Some presenting sensory symptoms may include vertigo, olfactory symptoms, or tingling. Finally, other manifestations include autonomic changes, such as sweating or flushing, and psychic symptoms, such as fear and hallucinations. As we just discussed, the second type of partial seizure is called complex seizures. A complex partial seizure describes focal seizures during which consciousness is impaired. The patients may also experience automatisms, which are unconscious repetitive movements that have no purpose. Examples include lip smacking, chewing, or swallowing. Finally, a complex febrile seizure is similar to a complex partial seizure, but the cause is due to a fever. This is a picture of a 2-month-old boy demonstrating the asymmetrical tonic limb posture right here. The asymmetrical limb involvement indicates a partial seizure. This position is also called the fencing position. All right, now let's try a question. A 10-year-old girl is brought to the emergency department by her mother, who witnessed her undergo an episode of upper right arm jerking. The mother adds that during the episode, her daughter was unresponsive. The episode lasted for about 2 minutes, after which she was confused and sleepy. When asked about the event, she had no recollection of it. Her temperature is 37 degrees Celsius. What is the most likely type of seizure that this patient experienced? So this is a 10-year-old girl who was witnessed by her mother having a seizure. So her arm was jerking. And we can see that only her right upper arm was affected, so only one side of the body had abnormal activity. This indicates that she had a partial seizure. According to the mother, the girl was not responsive during the episode, and the girl does not recall having the episode. This indicates a complex seizure, since consciousness was impaired. So this all points towards the most likely type of seizure being a complex partial seizure. Remember that complex partial seizures are focal seizures where the consciousness is impaired. Okay, now that we've discussed partial seizures, let's move on to discuss generalized seizures. Generalized seizures involve both hemispheres, and there are many types. You can see many of them listed here. Unlike a partial seizure, which may only involve one side of the body, generalized seizures involve both hemispheres and therefore produce abnormalities affecting the body bilaterally. Tonic-clonic seizure is the most common type of generalized seizure. It consists of alternating between the tonic phase, which is characterized by stiffening or rigidity of the body, and the clonic phase, which is characterized by uncontrolled repetitive muscle movements. Seizures can also present with only tonic or clonic phases. Myoclonic seizures present with rapid, repetitive muscle jerks. These are arrhythmic, meaning there is no pattern to the movements. This is in contrast to clonic seizures, which are characterized by rhythmic movements of the muscles. Atonic seizures are characterized by a loss of muscle tone, causing the patient to drop to the floor. It's therefore dangerous as it can lead to severe falls and injuries, though it's often confused with fainting. To differentiate these, remember that seizures can lead to loss of bladder and bowel control, as well as tongue biting, which are not associated with fainting. Absence seizures are a type of generalized seizure that presents with brief episodes of blank stares. They're typically not preceded by an aura or a postictal state, meaning there is no confusion after the seizure passes. They can occur many times throughout the day. Absence seizure is most commonly present in children and can disrupt their school performance, and teachers will remark that the child stares into the distance frequently. On EEG, a classic finding that can be described is the presence of 3 Hz spike and wave complexes. Finally, absence seizures are treated with ethosuximide. Before we move on, let's briefly mention simple febrile seizures. This is a generalized seizure that is caused by a fever and is most commonly tonic-clonic in nature. So by generalized, we mean that it involves both sides of the brain and causes movement throughout the limbs bilaterally. And by tonic-clonic, we mean that there is alterations between body stiffness and uncontrolled repetitive muscle movements. All right, now let's talk about epilepsy. From the overview slide, notice the asterisk next to both partial and generalized seizures. If either of these are recurrent or unprovoked, the diagnosis of epilepsy can be made. So epilepsy is a disorder of chronic, recurrent, and unprovoked seizures. Unprovoked seizures refers to seizures that are not caused by identifiable factors, such as lack of sleep, tumors, or trauma. Status epilepticus is a critical condition that can occur in patients with epilepsy. It's defined as a single seizure lasting 5 or more minutes, or the presence of recurrent seizures without regaining consciousness in between. It's important to recognize that this is an emergency, and the treatment is IV benzodiazepines. All right, now let's finish up by discussing differences between fever and hyperthermia. Here is a table that summarizes the most important differences. Let's start with fever. Fever is defined as the increase in body temperature more than the normal daily variation. The hypothalamus responds to the cytokines by increasing the basal temperature of the body, resulting in a fever. Fever is most commonly caused by infection or inflammation. The body temperature during fever is usually less than 40 degrees Celsius, and it can be treated with antipyretics, such as NSAIDs or acetaminophen, to block the cytokines that act on the hypothalamus. The underlying cause of the fever should also be treated. For example, antibiotics can be given to treat an underlying infection. The fever is usually resolved by treating the underlying cause. Fever can cause febrile seizures, especially in children, but this is generally considered benign. Hyperthermia, on the other hand, is an increase in body temperature that exceeds the body's ability to dissipate heat due to either external or internal sources of heat. An example of an external source is a heat stroke due to an extremely hot environment. Internal sources include medications that can cause serotonin syndrome or metabolic diseases. Hyperthermia can raise the body temperature to above 40 degrees Celsius. The management is different than fever, as this includes the rapid reduction of body temperature via physical means, such as cool baths and IV rehydration. The use of cooling blankets, however, is not recommended, as this can lead to excessive vasoconstriction and decrease heat loss. Hyperthermia can be rapidly fatal. That's why it's important to recognize and treat it promptly. It can cause a wide range of organ dysfunction, including ARDS, arrhythmia, neurologic dysfunction, and multi-organ failure. All right, now that we've covered the information, let's review with a final question. A 9-year-old boy is brought to the physician by his parents due to inattention. His parents complain that he does not listen to them and is frequently found staring into the distance. They have also received various phone calls from his teachers due to his declining academic grades. They do not report any abnormal body movements or loss of consciousness. His medical history is significant for a mild upper respiratory tract infection that resolved on its own 3 weeks ago. On physical examination, the boy is alert, answers questions appropriately, and is playful. What is the most likely diagnosis? A. Simple partial seizure. B. Partial complex seizure. C. Absence seizure. D. Generalized myoclonic seizure. All right, hopefully from the question stem, you notice that this child is frequently found staring into the distance. He also is inattentive and has declining academic performance. Collectively, is consistent with an absence seizure. So the correct answer is C, absence seizure. Recall that absence seizures are a form of generalized seizures that present with brief episodes of blank stares. All other choices are incorrect as they do not classically present with frequent staring episodes, which is typical for absence seizures. So, for example, choice A can present with motor symptoms, such as repetitive muscle jerks or other sensory or autonomic abnormalities, which has not occurred in this case. B is wrong because these are commonly associated with automatisms, such as lip smacking or chewing. D is incorrect because generalized myoclonic seizures would present with rapid, repetitive muscle jerks. So again, the correct answer is absence seizure. And that concludes this section.